So it looks like 72, 73, Mom, okay?
Before families leave the hospital after the child's first heart surgery, parents are almost always anxious, but they're also usually pretty excited. They've been in the hospital for a month to 6 weeks, and they're ready to get their baby home.
It's frightening enough taking home a newborn baby. I mean, we're past what color do I paint the nursery. When you take your baby home for the first time after they've had especially major congenital heart surgery or major cardiac complications, they have an incredibly onerous amount of additional information that they have to worry about on top of the normal newborn stuff.
When my son was born with a congenital heart defect up here at UVA, it was a frightening time. One thing that I wasn't really prepared for was leaving the hospital. When we took our son home, I wish that I could have taken all the doctors and all the nurses with us and filled up the van with all the equipment. It was frightening because literally with congenital heart defect, everything can change in one heartbeat.
When I took over the program at UVA about 5 years ago, we would send patients home with a binder, and that binder was a set of tables and a couple of tabs that had them write information down. I felt that we were doing things with 1950s technology, but utilizing medicine that was, living in the 2000s.
UVA has been a great partner through many programs that we've designed with them. Their children's hospital specifically, and the leadership that's supporting the children's hospital, has a vision of innovation. When UVA Children's Hospital asked us for a solution to monitor these vulnerable infants remotely, that was when Building Hope was born.
Each morning when I get to work, I log in each patient and check the Building Hope app information, and I can ensure that their oxygen level is good and that their weight is increasing and that they look like they're feeding well.
If they do enter a vital sign that's out of limits, then a clinician can look at that data point right in the patient's electronic medical record. They can then alert the physician who can make that timely intervention. It really is about getting the right information to the right person at the right time.
Having that available and at our fingertips was amazing. It brought down the fear aspect of it and definitely made it a little bit more comforting.
We know that parents are afraid when they go home with kids with this level of disease. And it's been amazing to see the gratitude and the calmness that comes over them when we can send them home in ways that allow them to stay engaged with us from day one.